To all who are new here, my name is Dr. Michelle Henney, and I'd like to welcome you to Releve Sports Medicine's Virtual Journal Club. For additional webinar educational opportunities, you can visit our website and register directly for the webinar or sign up for the email list to be notified of upcoming webinars. We are continuing to update our schedules, so check back often. This video will be available for review after this journal club. The information contained in the video content represents the views and opinions of the presenters and does not represent the views and opinions of Releve Sports Medicine. The mere appearance of video content on the website does not constitute an endorsement by Releve Sports Medicine or its affiliates of such video content. The video content has been made available for informational and educational purposes only. The video content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or seen on the site. Releve Sports Medicine hereby disclaims any and all liability to any party for any direct, indirect, implied, punitive, special, incidental, or other consequential damages arising directly or indirectly from any use of the video content, which is provided as is and without warranties. We are looking for an athletic trainer to join our team. This is a full-time clinic-based position working in a sports medicine clinic. BMO certification for X-ray is preferred. Please feel free to pass our information along if you know of a qualified candidate. More information regarding applying can be found on our website. For all athletic trainers who are intending to get live CEUs from the BOC, you will receive an email 1 hour after the webinar concludes, which includes a link to the combined quiz evaluation and assessment. You will have up to 72 hours to complete the quiz and the evaluation. This email will come from customercare@gotowebinar.com. Please ensure that this is done to receive your statement of credit. If you don't receive the follow-up email or you have any other concerns, then contact us via our email at journalclub@relevesportsmedicine.com. Once the statement of credit is available for download from our website, you will receive an email notification. If you have any questions during the webinar, please submit the question and we will review questions at the conclusion of the presentation. If you cannot see the PowerPoint slides and you're accessing the webinar from your mobile phone, swipe the screen to the left or to the right and the slides will become visible. The recording will be available for review from our website tomorrow. I'm pleased to introduce you to Dr. Justin Thompson. Dr. Thompson is a sports medicine physician who completed his undergraduate training at USF, followed by residency and fellowship at Bayfront Health. His certifications include USA Weightlifting Level 2, CSCS, Pregnancy and Postpartum Athleticism Coaching, FMS Level 2, and RAD Mobility Level 1. He served as an affiliate physician to the Tampa Bay Lightning and has continued to work with the junior Lightning high school hockey teams. He participates himself in ice and street hockey, and he will be speaking this evening on Introduction to Hockey Coverage. I'll have you take it away, Dr. Thompson. And it has that you are self-muted.
All right, how do I take over the screen now?
Okay, you should have a button that has popped up, and if you didn't, I will switch it back to me. And we'll go back to you. Okay, you should have a button pop up on your screen saying, do you want to take over?
Can you see it?
Share. It still says it's waiting to view.
The button popped up and I hit yes.
Okay. Let's see. Sorry, it still says that it's waiting to view your screen. Your center has control. Do you happen to have a Mac? Not that it matters, but just asking.
Yes.
Okay. Do you think, can you email me your PowerPoint? Because sometimes Macs don't like GoToWebinar, and I will open your PowerPoint.
It is the Apple version of PowerPoint, so I don't know if it's gonna, let me see if I can save it different. It's too big with the pictures. Let me see if I can.
Ian sent it to me, although it's coming in as a, okay. Let me close here and go back to here, and then I'll change myself to the presenter. And then I put smaller. Okay, it looks like we will do it this way. And if someone from the audience can just confirm with me that you guys are able to see my screen here as is, then I will work on making sure that my screen is as big as possible. Chat or
If that was the initial one that was sent over, that one's not going to have everything in there. So let me see if I can have a workaround with this real quick.
okay.
Sorry, everybody. Presentations that started off with technical difficulties, but we're going to have some fun with this moving forward. So the biggest thing as it relates to what today's lecture is going to be on is kind of an introduction to ice hockey in general and coverage. So we're going to get into a little bit of everything as it relates to just talking about the aspects of what ice hockey is, how many players are on the ice, those types of things, and then go through a couple different things while getting into the equipment and all that. If there's any questions as we go along, please reach out and we'll be happy to answer those. If you guys have any questions at the end of this or afterwards, I'll be happy to answer those as well. So without wasting any more of your time, let's get started. So as it relates to disclosures, I have no relevant financial disclosures related to this talk. All the equipment in this lecture has been utilized as an example and does not kind of constitute the only style of equipment. And the other thing as well is you guys are talking to somebody that was born and raised in Florida. I did play ice hockey, but you're kind of stuck with a Floridian teaching you about ice hockey. So the objectives today are going to be to discuss some of the hockey basics as it relates to different terminology and stuff like that, and then also getting into hockey equipment, common hockey injuries, and then a discussion of quick evaluation tips. Because when you're dealing with somebody that's got their full gear on, it can be very difficult to try and figure out, okay, how do I evaluate this knee, or what's going on in this situation? Am I concerned about fractures, a sprain, a strain, those types of things. So it can be very difficult to do that with the equipment on. So we'll quickly go over how to, maneuver through some of the equipment and stuff like that to get to those areas to expose those body parts. So here's going to be the quiz associated with this as we go through. So the biggest thing is just talking about, as an example, how much does a hockey puck weigh? What is the name of the NHL trophy that's given away? What portion of the head is the most commonly injured? And then a couple true and false questions that we'll go through as we get through, and hopefully you guys will be comfortable with answering this quiz as we get to the end. So when we're talking about some of the Hockey 101 stuff, a lot of this is related to the National Hockey League rules. Some of that is carried over, but there are adaptations for the level that the athletes are playing at. So whether they're in the recreational leagues or whether they're in travel leagues and stuff like that, all that is going to determine, whether there's variations in the rules, the size of the rink, the weight of the puck, stuff like that, because all that is now changed as it relates to the development of the athlete. So we'll get into that a little bit more as well as we get farther along. Just a couple other things for you to kind of jot down if you have something to write on is, writing down these answers real quick as we go through a quick quiz in terms of how many players are on the ice at a time, how many periods are there played during a game, how long are the games, and can you end in a tie? So to answer these questions, getting into it, so 5.5 to 6 ounces is the typical weight of a standard NHL puck. Now, again, this weight can vary based on the division that the person is playing in. So the younger athletes in the development leagues and stuff like that will often have lighter weight pucks to help with skill development and strength development as well. So they're not developing other problems associated with utilizing something that's too heavy for them. The amount of players on the ice at a time per side is going to be 6. So you have 5 skaters, 1 goalie, but that's going to be doubled for the other team that's on the ice as well. So there are times when the team will pull the goalie late in the game if they're down by a goal or two to try and get that 6th skater or 6th attacker on the ice to try and give them an advantage to try and score on the other team. There are 3 periods in a game. They're usually about 20 minutes long. And then again, this varies based on the level that the athlete is playing in. And under the current regulations, there can be no tie associated with a regular season game or a playoff game. It will come down to, an overtime. The rules vary from regular season to playoffs. For a regular season in the NHL anyway, it drops down to a 3-on-3 session that is 5 minutes, followed by shootouts, and whoever wins that then becomes the winner of the game. Whereas in in playoffs, you go to just playing regular 20-minute periods beyond that point. So at that point, it is, you're going to go through until somebody scores to have that final goal to determine the winner. So getting into the hockey divisions now, just so that you kind of heard these terminologies, the terms anyway, when somebody comes in and says they play in the Pee Wee division, a lot of times if you have no idea what that means, you're like, okay, well, what does that mean? Are you in the smallest division, or highest division, those types of things, because the wording can often be confusing. So when we're talking about mites, that's usually under 8. Squirts is 10 and under, Pee Wee 12 and under, Bantam is 14 and under, and then you get into the terminology starts to get a little bit weird. Okay, we're talking about midget 18 and under. Does that mean that they're bigger, smaller? What's going on? And same with juniors. It's usually over 18, but that can be, kind of confusing because there's 2 leagues that can run, or different pathways to professional leagues. Going through the junior route in terms of anything over 18, you're in a kind of a semi-professional league at that point, or going the route of going to college and playing that way. And then at some point you are drafted into the professional ranks, and then you play, with the professional teams at different levels. So now what we're going to do is get into a quick equipment overview. So we'll start kind of. This picture on the right is just a depiction of what somebody would look like without a jersey or socks on, to see the equipment, see the coverage, and actually see the areas of exposure wearing this equipment. So when you think about that ice hockey puck that is roughly 6 ounces that can be rifled, anywhere from 70 to 100 miles an hour based on the shot and the location, hitting somebody in one of those spots where you see open spots or just padding that's more or less cloth through those spots. That is essentially just taking that puck directly to the skin, and that's going to be extremely painful for a lot of people. So that's where you need to, for blocking shots and stuff like that, or unfortunately getting in the way of shots that you're not intending to get hit in certain areas. A lot of these people will have to make sure that they are blocking the shot appropriately versus getting out of the way completely so it doesn't hit them. So when we're taking a look at the helmet, and depending on the league that you're in, eye protection is required. At the NHL level, it is required to have a visor. You do see some people that don't wear a visor anymore, which a visor is essentially just a hard plastic piece that covers over top of the eyes, but the bottom portion of the face is exposed. However, now the rules have changed where before you could do that versus just wearing the top of the helmet piece without, the visor or anything else. The rules have changed where players actually have to opt out of wearing a visor, and they sign additional consents and stuff like that saying that they don't want it. But again, it's one of those things that as we get into a couple of studies here that talks about injury prevalence and everything else, that we've shown that wearing the shields as well as full cages do decrease your risk of having injuries to the face and eyes, but it doesn't necessarily lead to any additional injuries as it relates to head and neck problems, because of the fact that now you have full protection. So maybe you're doing things that you wouldn't necessarily do if you didn't have that full protection there. And then in the professional ranks, the majority of people do wear the visors. Very rarely do you see people that don't wear them anymore. Now, worn correctly is a different different story as it relates to whether or not they actually wear them to cover the eyes and everything else so that they have that full protection, or their visors are tilted a little bit. So that's a completely different story. So when you take a look at the shoulder pads themselves, they're typically going to be a hard plastic chest piece that you can see in the middle there, that kind of looks like a hard plastic piece, but the rest of it outside of the shoulder cups are just a thick foam. So in certain cases, if you get hit with a puck, a stick, or take a cross check or something like that, which is essentially somebody taking the shaft of their stick and hitting you with it, that can be extremely uncomfortable, hitting in those particular spots where you don't have that plastic to disperse the force across the width of the that area that it's being hit. And then the typical shoulder cups and stuff like that are very similar to what you would see in football pads and stuff like that. Obviously not as bulky, however, they provide the same distribution of the force and protection as it relates to contact. Elbow pads, same thing. You're going to have a kind of hard plastic piece. So as you can see on these older style elbow pads here, you have essentially a hard plastic cup that the olecranon area is going to sit into. So that posterior aspect of your elbow is going to be covered and protected. So when you fall directly on the elbow, most of the times people don't have any issues associated with that as it relates to those falls, because that hard plastic piece absorbs that energy, and then underneath that is where all that foam padding is to help with the impact of that fall, so that way the person doesn't feel the direct pain over the elbow when they fall onto it. It's usually Velcro straps across the front. Typically there's an extension that goes beyond the distal piece of that elbow pad that will cover the wrist a little bit and is utilized as a slash guard, because as the jersey moves and stuff like that, you can't expose the skin through that area, and when people are trying to maneuver defensively to disrupt the offensive player's control of the puck, oftentimes you can get a slash across the wrist and stuff like that that will lead to pain or potential fractures or other injuries associated with direct trauma to that area. Doesn't happen too rarely with the padding, but it can be something that becomes another issue for the people that don't have direct access to slash guards or additional coverage of the skin through that area. If they fall and somebody skates over that area, as we saw recently earlier this year in the NHL, that it can be, devastating for that player, where you have that skate that inadvertently skates over that area or gets stepped on or something like that, where you essentially sever a lot of arteries, nerves, veins, as well as tendons and potential muscles as well through that area that can affect them moving forward. The gloves themselves are, the only padding is really on the back side of the gloves. So when you see the palmar aspect of the gloves here, it's really just a thin leather piece that helps with essentially just providing a little bit more control of the outside of the glove, so that when you squeeze those fingers together, it does bend the gloves down, but the only protection really is on the outside of the glove there. So on the inside, there's really no protection from getting hit with a puck or anything like that. So those are those areas that if somebody gets hit in the hand, if it doesn't hit over top of that area, or it hits a different side, or it happens to catch the glove in a wrong spot, or they try and catch that, they're going to be dealing with more problems with fractures associated with those, with your hand and stuff like that from the direct trauma to that area. The pants themselves are a thicker padding and foam underneath the posterior aspect of the pelvis there. So as you can see on the top view looking down into the pants there, that essentially that light gray piece all around the outside there is where you get a lot of your padding. Now in the bottom portion of that frontal view of the pants there, where you have, where it says essentially octane on the front, that's a hard plastic piece. But on the inside portion of the groin and the inseam there, there's really no padding at all. It's just a waterproof fabric over that area, and oftentimes does have some elastic that stretches a little bit. But other than that, there's really no padding in that area. So that's where the supportive structures for the groin and stuff like that, and the protective equipment there, become the majority of the support through that area in terms of protection, because the pants themselves don't offer a great support for groin protection, especially in that area. The shin pads themselves, again, they're going to be that hard plastic front, where you have a nice, foam on the inside, that if you fall while you're wearing these shin pads, or you get hit with a puck directly over the plastic piece, oftentimes that doesn't necessarily cause any pain. You'll feel the pressure, but it doesn't have the shin pads themselves will absorb that force, and it doesn't lead to significant problems as it relates to direct trauma to to that lower portion of the leg. However, as you see at the top there, where there's that extra little foam padding, when somebody bends their knee, and if their pants were to slide up or anything like that, the top portion of the knees exposed there, so that lower thigh is going to be exposed. So if they happen to go down to block a shot in a way that exposes that area, and the puck directly hits that area, that's going to increase your risk of damage to that spot, because there's no padding over that. The socks are just essentially a piece of fabric over that area to make the uniforms more essentially uniform from one team to the other, to be able to tell the difference. So with that, it doesn't necessarily provide any protection at all. The Velcro straps will wrap around and essentially just hold it onto the leg at that particular piece, and what will keep it from sliding up and down is usually the fact that if it slides down at all, it's going to get stuck on the skate, so it doesn't continue to fall off, and then those Velcro straps will keep it attached to the leg there. Some people will rip those Velcro straps off, and then when they put their socks over top of it, they'll tape over the socks to hold the socks in place, as well as hold the shin pads in place. So it's really based on the athlete's preference as to how they do that. And the reason I bring that up is later, as we talk about exposure to these areas, to how to take this equipment off if you need to very quickly, to take a look and assess different situations based on trauma to different areas. So the skates, with that picture on the top right there, I apologize, it didn't come out very well, but what I was trying to depict there is, yes, you can see the blade on the bottom, but what you should also be seeing is that there are two edges to that blade. So when people talk about skating or they've lost an edge or whatever, that what they're saying is essentially that little small edge on either side. So it should look like there's a little bit of a valley in between that blade. So the middle portion should be a little bit lower as it relates to the outside edges, and that's where you kind of get that V or N shape associated to that blade, so that people have their inside and their outside edges. Yes, this can be very sharp if hit in a certain way, that it will lacerate skin, it will cut through jerseys, it will cause a lot of issues. So when people fall and these skates come up and hit people in the neck, stuff like that, or catch jerseys, you will see tearing or potential lacerations to the skin there that will lead to significant trauma through that area, depending on how deep it goes. Now the blade itself is attached via a chassis or a blade holder to the boot. The boot in the majority of cases is made of a thicker leather or a ballistic type of nylon. So yes, taking shots to the side of the boot can oftentimes be extremely uncomfortable based on what they have going on in terms of the makeup of their boot. However, with the ballistic nylon, it doesn't hurt as bad because it doesn't deform, and what will actually deform is the puck itself, because it is made of that rubber, where it will deflect some of that energy, and the person may not necessarily feel as much discomfort. Still going to hurt, but not as bad as if they were comparing that to getting hit with somebody that's just got a kind of a thicker leather boot. Majority of the boots themselves, though, do provide a lot of stability. So in terms of inversion and eversion of that ankle, very rarely does that occur in terms of leading to ankle sprains that we would typically see with somebody that was running or anything like that. It's more of a twisting motion where you end up with these high ankle sprains that lead to significant problems down the road in terms of recovery and getting back out on the ice and stuff like that. Some players will also add in another hard plastic piece that actually goes over the top. So where the laces of the skate are, it will sit over top of that, and actually where the hole is between the blade holders and the boot, it'll wrap underneath there and Velcro down, so that if they block a shot with the top portion of their boot, which is essentially just a thick pad of foam and laces, and outside of that, there's no protection there. There is protection on the toe of the skate, but outside of that, over where the tongue is of the skate, not a whole lot of protection there. So that's where they'll add that additional piece to allow for further protection through there. Now the groin protection here, with this typically going to be a cup or a jock strap for your male athletes, whereas your female athletes will have a full pelvic protector, which acts very similarly, but it doesn't have that concave aspect to hold the anatomy of the male athlete versus the female athlete. Those are often referred to as jills in the case of women, that provide protection through the groin area that is not being provided by the pants themselves, and this is usually worn underneath the pants. On the bottom here of these, this aspect of the girdle that houses the cup inside of it does have the Velcro strap. So usually what people will do is they will pull their socks up and attach them to that Velcro there. So that, knowing how the patients or your athletes attach the socks to their hold them up, essentially, is going to be easier for you to just be able to tug on the sock to dislodge the Velcro and pull it down to access the shin pad very easily, versus trying to have them undo the girdle aspect that's holding it in place as well. So we'll get into that. So as it relates to the jerseys and socks, so you have that that uniform in place, and the socks will be pulled up, and this is an example of a girdle here with a zoomed in picture of those actual clips, which you will essentially, what they'll do is they'll take that one rubber piece on the inside of the sock, put the metal clasp on the outside, and then pull it together as a kind of a garter belt type situation to hold that sock up. In that case, if you're tugging and pulling on that sock to get it to come down, it's not going to, because of how this is held in place. So in that case, what you would need to do is actually unclip those to pull that sock down. Some people utilize this in combination with the Velcro to make sure that it stays in place so that it's not sliding down, or in combination with tape to make sure that those socks aren't moving. The jerseys themselves, which were originally called sweaters, are essentially just a thin piece of fabric over over top of all that padding, that is more so just to, delineate one team from another, and doesn't provide any protection at all. Now, so this is a picture of the Stanley Cup, which is the trophy that's awarded through the NHL playoffs to the winner throughout the year. It is the oldest trophy in North American sports. It was originally just that top bowl there, and then throughout further iterations and adding names to the trophy of the winning teams, that trophy is subsequently grown. On the bottom portion there, where that fatter piece is where you have those names, and those rings are actually removed as they're filled up and moved up, and those are eventually retired, and they're stored in the Hockey Hall of Fame and stuff like that, for people to continue to see and look at. So this is one of the only trophies as well where the actual names of the winners are engraved on the trophy, and they stay there for a period of time. Now we'll get into some common injuries as well associated with these particular areas. Some of them are going to be not necessarily highlighted as much because of the padding over certain areas, and the injuries themselves aren't very prevalent. So we'll get into this as we go along. So when we're talking about the head and neck, also just a quick note, it is very difficult to smile when you have a full cage on. So just in case you ever wonder why some of your athletes maybe aren't smiling with that full cage, because it can be very difficult if that helmet is worn correctly. So when we're talking about injuries to the head, concussion, yes, does remain one of the big areas of injury associated with this. Usually it's going to be in the youth athletes, where the skill level may not be what it typically is at the higher levels, in terms of kids keeping their head up, maybe having inadvertent contact to the head and neck region that leads to concussions. However, the rate of concussion doesn't necessarily drop off a significant amount. It's still one of the higher injuries to the head and neck region. However, facial lacerations usually go up because of the fact that you're no longer wearing that full cage anymore. So because of that, and with that shield alone, those injuries typically go up because of the fact that you're having skates, pucks hit you in the face, sticks get, from high sticking and stuff like that, or just contact with other players, or the boards themselves and stuff like that, that can lead to lacerations or abrasions of the face, or broken nose, eye injuries, dental problems, stuff like that. As it relates to the shoulder, the most common injury there is going to be that AC joint separation. In the NCAA studies, and I apologize, I didn't have a chance to add those references to this lecture, but we'll make sure to get them sent over so they can be emailed out. But the majority of those cited the prevalence, injury prevalence articles did cite that the AC joint separation is usually within the top 3. Depending on which article you look at, it can be as high as number 2. Because of the fact that the direct trauma to the area as it relates to just contact with the boards, players, ice, falling in awkward positions can lead to injuries here, as well as glenohumeral dislocation, which doesn't happen very often. And it's usually going to be muscle strains and stuff like that that kind of follow next as it relates to the AC joint separation through the shoulder through this area. Typically, these athletes are going to be smaller as it relates to your football athletes, which are going to be a lot bigger in terms of their mass. However, the speed at which these athletes are traveling, the force that's traveling through the shoulders and the contact here is going to be a lot higher in these smaller athletes, because of the speed that they're traveling in terms of hockey as it relates to in comparison to your football athletes. Now, as it relates to the chest here, so this is just an example with the arms up overhead, how the shoulder pads and the pants themselves do expose certain areas depending on what you're doing. So when you take a look at the side there, there's more exposure with the arms up versus with them down. This area is not very commonly injured because of the fact that you have that hard chest plate over there. It's usually on the sides where you may end up getting rib fractures and stuff like that from cross checks or hits with that stick and everything else, or somebody falls and takes a shot from the puck into the back where there's not as much protection back there where you can actually fracture ribs, but it's usually just going to be contusions and stuff like that through this area. Now, same picture when we're dealing with the abdomen, again, with hands down, typically the abdomen is not a common site of injury with direct trauma to that spot. Now, with the arms up or falling or any particular movements where you take a shot to the abdomen from a stick, a puck, you run into the boards, you hit the net, something like that, then that can be an area where you have direct blunt trauma to the abdomen that can lead to intestinal injuries and stuff like that. Although those are extremely uncommon, it can happen. Usually in this case, in the abdomen, you're going to be getting more problems with muscle strains as it relates to oblique strains. Sports hernias are kind of more of a question of more muscle imbalance versus direct injury to where those abdominal muscles attach to your pelvis and everything else, but a different story. So in the abdomen, less direct trauma to this area because it is a little bit more protected. Same with the elbow, uncommon injury pattern here as it relates to the falls and stuff like that because of the fact that you have those elbow pads that do their job in terms of stopping falls through that area. Now, however, if that shoulder or if that elbow pad shifts and somebody falls, then you can be dealing with dislocations, fractures, and stuff like that associated with the elbow. But very rarely does that happen. It's usually more muscle strains around the elbow associated with the brachialis, the biceps, and then where your forearm muscles and stuff like that attach around that area that can lead to more overuse injuries and stuff like that. The hand and wrist, again, this is an area that can be easily injured because of the fact that you do have exposure with certain movements. Slashes and direct trauma from sticks can often lead to wrist fractures or just significant problems with bruising and injuries associated with that can lead to other irritation and everything else through that area. Lacerations that we talked about already from skates and sticks and everything else. One thing I do want to point out here in the glove there in this picture, you can actually see my fingers and the top, my index finger, my middle finger, because of the fact that through that area that little bit of leather through there actually tore. So for that, again, essentially those fingers would be exposed in the palm there for direct trauma through anything. Now, sorry, we're going to go through these areas a little bit quicker because through this, it's more lumbar spine. You're not going to have direct significant injuries through this area unless we're talking about cervical spine injuries, which is not necessarily touched on in this particular lecture. But one of the things here that I do want to point out that you can get overuse injuries in this area. But the majority of time, what you're going to be dealing with direct on ice injuries is going to be related to muscle strains, unless there's direct trauma and an axial load through the C-spine area where you're going to be more concerned about that versus actually the lumbar spine. The hip itself, as you can see here with certain movements and everything else, you do kind of put that hip at a bit of a disadvantage for people that don't have great range of motion. And this can also lead to muscle imbalances and everything else and groin strains and everything. But usually in this case with direct trauma to the hip, it's going to be labral tears and stuff like that. FAI can be something, or that femoral acetabular impingement can be something that develops over time and may not necessarily be something acute. So these are kind of one of those areas, because of the padding through here, is not going to be something that you get direct trauma to, but can be something that develops injuries over time. For the knee itself, it's going to be related to muscle strains. Meniscal injuries can be involved as well. But the other thing that's usually going to be the biggest issue associated with these injuries is going to be somebody falling or landing on somebody that has that outstretched leg. That's going to lead to an MCL sprain or complete rupture there. That is one of the top 3 injuries that does occur in the, as it relates to the injuries, with concussion and facial lacerations being number 1, followed by AC joint sprains, and then those MCL sprains and tears are going to be kind of the top 3 that you'll usually see in this case. So in that particular situation, based on your athletic population, you may want to figure out, are you dealing with growth plate injuries or direct trauma or potential fractures? And that's where you got to expose that. And we'll get into that here in a few slides as it relates to getting direct exposure to that area and how to quickly remove that equipment. ACLs, PCLs, and LCL injuries don't occur all that often, although they can, based on that foot getting stuck in the ice or getting hit or turned a certain way that transmit that force up, leading to those ruptures. Foot and ankle, again, it's going to be more trauma from direct block shots. You can have issues with fractures of your foot from that. Inversion and eversion injuries, as we were talking about earlier, are very uncommon because of the fact that that boot itself is rigid. But what you will have is twisting of the ankle, which then leads to those high ankle sprains. Now, we're getting into assessment. So again, these particular tips through here are not going to be the only ways that you go about getting to these particular spots, but it is a couple different areas to get exposure to that. And then obviously, as you work with these athletes a little bit more, you'll be able to fine tune how you feel you're able to get to these areas a little bit easier. In terms of fully removing all the equipment, in some cases you don't. As you can see here, there are areas that are exposed already without removing any equipment. So you can get underneath the shoulder pads and stuff like that without completely taking them off, as you do in football, to get to the clavicle, assess that area, assess the AC joint, and see what's going on with that, and try and get direct access by just sliding your hand underneath the pads there, as you would in football shoulder pads. As it relates to the helmet, so the chin strap itself is usually attached to either the cage. If somebody has a visor, the visor itself is attached directly to the helmet, so there's nothing to take off there. So it's just that bottom. So on the picture here, it's going to be the top strap that you see. That's kind of off to the right there. That's just the one thing that pops off. That whole helmet comes off. Even with the tight fitting helmets, or the appropriately fitting helmets, they usually come off relatively easy. And these are just kind of snap-on straps where they're easy to pop off and take off. So you don't need any special equipment to get those off. And for whatever reason that, say newer equipment or whatever, new styles of helmets are out that are similar to football helmets, you may need to cut those straps to get the helmet off, those types of things. But in these cases, it's just a thin fabric that are easily cut with trauma shears and stuff like that if you aren't able to get that snap off completely. Shoulder pads themselves, it's four Velcro straps in particular. The 2 on the top of the picture there are going to wrap around the abdomen. Here I apologize, I didn't unstrap the Velcro pieces that go onto the arms, but that's just the other 2 straps there. So it's 2 pieces that strap around the upper arm and 2 pieces that strap around the abdomen, that you unvelcro those, you can take them right off over top. If you need to expose this area, cut them off, you just cut off the sides, cut those 2 pieces in the middle, and if you need to, you can actually cut the top pieces there, excuse me, that wrap over the head and neck region, and then you essentially just disassociated the front and the back of those shoulder pads, and it'll come right off. Elbow pads themselves, again, they usually slide off. Most of the players will have it so that the Velcro is there to kind of hold it on, but as you shift and move around, they will slide, so they can often slide off without you having to do anything else. But if you need to expose that area because you're concerned about it, if you actually roll the sleeves of the jersey up, you can either cut those Velcro pieces off, or you just unvelcro them and the pad will fall off the bottom. Gloves themselves, they just slide right off. Nothing really that holds them on other than the patient's hands and grip strength there that will keep them from falling off. pants themselves, in most cases, you don't have to remove the pants to expose the upper thigh or anything like that, because of the fact that they are relatively mobile. You can just slide them up. If you need to take the pants off, you need to ask the athlete, do they have suspenders on? Because if you cut the lace there and the belt that's holding them up, and you try and slide them down, at that point the suspenders are going to hold them up. In the case here, which you can kind of see off to the side, you can see those when you expose the laces and the belt of the pants, that you can actually see that there's suspenders there, that you can actually just cut those if you need to, or quickly unhook them and slide that off so that everything slides down. In some cases, some of the styles of pants will actually have a zipper in the groin region, where you can unzip those and expose that area to make it easier to get those pants on and off, but most cases they don't. Shin pads, again, the easiest way to expose this area is going to be to take those socks down, and you don't need to take the pants off to do that. Talk to your athlete, say, hey, are these Velcroed on? Is there tape holding these up? What's going on? So you can quickly take that down, pull the socks down, and take a look at that area, and just take those Velcro pieces off to pull the shin pad off if needed to expose that area. Quickly evaluate the knee if need be, and then you can put it back on if you feel like, all right, everything's good here. It's just everything's stable based on what they're complaining of. Most likely just a muscle injury or block shot to that area. I'm not concerned about a fracture. You can potentially put them back in the game in their next shift by just putting that back on, and they don't even miss any time on the ice. The skates, the more, just like with boots and stuff like that, the more laces you take out and take out of the little eyelets there, the easier this is going to be to take that skate off. If somebody blocks a shot and their foot starts swelling, and if you're concerned about a fracture, if you're taking that skate off, they're probably not going to be able to get their foot back in there if there's enough swelling. So at that point, you may want to consider, if they're able to put pressure on it and stuff like that, of trying to figure out, did they actually fracture that, or is it something that you're going to evaluate later based on the timing of the game, stuff like that, and the ability of the athlete to put pressure and skate on it. Obviously, if they can't put any pressure on there, you're going to want to take that skate off in the least aggressive way possible, which is going to be taking those laces all the way out, pulling that tongue all the way down towards the toe of the skate there, and sliding it off that way. So just kind of getting back to our discussion of our objectives here. So with the hockey equipment, it varies as it relates to the style of equipment. What was pictured here is just one particular brand as it relates to the shin pads, the helmet, stuff like that, where you can have extreme variations and particular athlete modifications that to make it how they like, that can modify how you assess and remove equipment and stuff like that. So just be aware of the general technique on how to get to those areas and everything else. Hockey basics, again, hockey is a fast-paced sport. A lot of the injuries that you're going to see there are common to your other contact injury sports, but it's going to be amped up a little bit because of the speed that these athletes are traveling. Again, with that high velocity and the style of equipment that is there, some of those hockey injuries can vary a little bit, but those injuries from direct trauma to from the puck, the boards themselves, other athletes are going to be what causes those injuries, or the stick themselves affecting the face and everything else. And then different equipment can lead to different variations and techniques of how you're going to remove those. So getting back to that quiz that we were talking about before, just going over that. So the weight of the hockey puck, again, varies, but it's going to be anywhere from 5 to 6 ounces, and it can be a little bit lower. But if we're going off of NHL rules, that's the size or the style that they're gonna, the weight that they're going to be going after. That National Hockey League championship trophy is the Stanley Cup. The most common portion of the head that's injured is going to vary based on your athlete's age. The younger population, because of that full cage, the lacerations to the face area are not necessarily going to be very high. And actually, they've shown that in some of these studies that there are no eye injuries or lacerations to the face in those particular populations, but it doesn't increase the chance of head or neck injuries. So that can be something that, again, that's nothing that you're going to change right now, but that can be something that, rule makers and stuff to try and make the game safer will address at a later point. But the concussions are something that are there in the younger population. They're still there in the older population as well, but the facial lacerations do jump up a little bit. And then as we went over, the pants do not provide sufficient protection to the groin region. That's where the undergarments and everything else are going to provide a little bit more protection for that area and the groin itself. And again, six players on the ice per team at a time are going to be, you will see that. Now, when you're dealing with line changes and stuff like that, because they change on the fly, that you will have more players on the ice at once, but in terms of actually involved in gameplay, it's only 6 players at a time. And then lacerations will occur throughout the game by other means other than just skate blades. You can get them from sticks, from the pucks, just contact with the boards, other players' equipment and stuff like that. So it's not just the skate blades that you have to be worried about as it relates to those lacerations. And I think that's it. I apologize for the speed of that and the delay in getting started, but if you guys have any questions, I know I've pretty much used up all my time, but please send those over. I'll be happy to answer those at a later point to make sure that all those questions get answered for you.
Awesome. Well, thank you so much. That was certainly an excellent whirlwind tour there of all of the equipment, all of the ways to approach if you are covering hockey. So definitely much appreciated. Agreed. Being in Florida, we're certainly not seeing a whole lot of hockey, but you definitely represent how important it is and how much there is to know and how different it is than many of the other sports. So I appreciate your time tonight.
Absolutely. Thanks for having me. And if you guys have any questions as it relates to hockey in general or coverage or anything like that, please have Dr. Henney reach out to me. I'll be happy to answer any of those questions to try and help alleviate some of that anxiety associated with covering a new sport or how to get, maneuver your way across the ice, those types of things. In most cases, just as it relates to maneuvering on the ice, just keep your feet under you. Don't try and move too quickly. If you need to get quickly to the other side of the ice, another player will bring you there, and just hold on and brace yourself, and you'll just slide across the ice and get to where you need to. So don't worry about that piece of it. Most of the players are very comfortable with that. If not, the coaches will be yelling for the players to help bring the trainer over there. So
good to know. I personally have not covered it, so it's all new to me what you're talking about. All right. Well, thank you again, and thank you to all of our attendees tonight. We definitely had a large interest in this, and so if this is something that you are interested in hearing about more, or if there are other topics that you're interested in hearing about, or speakers in particular that you would love to hear talk, please don't hesitate to include that in your post event survey, because we are always happy to reach out, and the worst they can tell us is no. All right, have a great night, everyone.
bye. Thank you.